It's good to be back with you one more time before we hit the end of our week. Similar to last week when we turned it over to Dr. Lynn Ogawa, I'm going to turn it over to another special guest for the rest of today's presentation. Dr. Thomas Nguyen works as a clinical psychologist within our social services department, serving people across this community suffering from mental health needs. I want to thank Dr. Nguyen and so many others for their work across our organization in helping bring our service delivery vision to light now and during this emergency period that we are facing. And I today want to thank him especially for his focus on employees and their own mental health and well-being as we work through a crisis. I wanted to open by acknowledging today that all of us experience the COVID-19 emergency in different ways. And every day, we may experience it differently than the day that preceded it. We have talked about this some already, but it is something that weighs on my mind every day as I think about the health and well-being of all 4,000 people and their families and friends and neighbors and loved ones every single day when we come to work. I think about it in the people that we serve as well, but I also know that if we don't pause for a second and look at the care of our employee base, we will not be able to serve well the people that are needing us most in this moment of need. I ask you to be kind to yourself whenever possible. I ask you to find ways to continue to reach out to others who may provide a lifeline to you in moments of need. And I ask you to be okay with the acknowledgement that not every day will feel great. There are going to be days of uncertainty, frustration, boredom, and just a yearning generally to want to get back to a life that we all preferred before we were dealing with this global pandemic. I don't have perfect answers on any of that. I don't bring them to you today other than to say I want to be here as one of many supports, hopefully, in your life. I hope this organization is able to continue to work with our employees in every setting to support them and their physical and mental health. And I want to thank Dr. Nguyen for engaging today in a conversation about some ways you can continue to approach your own mental health and well-being with Ramsey County. Thank you. Be well.
Thanks, Ryan, for the introduction and inviting me to be part of this video. My name is Thomas Nguyen. I am a senior clinical psychologist with the Social Services Department. I am located at the Mental Health Center at 1919 University. My primary responsibility here at the clinic would often be individual therapy, psychological evaluation, and clinical supervision of doctoral level students in psychology. With May being the Mental Health Awareness Month, and with the uncertainty surrounding the current pandemic, we would like to highlight some different ways to care for yourself and for your mental health. Well, certainly change is hard, and everyone is feeling stressed to a certain degree. The pandemic requires us to make life adjustment overnight, whether we like it or not. And the fear of not knowing the outcomes of this or having a lack of control could fuel stress. And when our body perceives stress, the adrenal gland create and release the hormone cortisol, or known as the stress hormone, into our bloodstream, which results in an increase in heart rate as well as blood pressure, in addition to having shortness of breath. And so some of us try to take control of this stress and anxiety, and just remember the toilet paper crisis that happened not so long ago in March. Some other people try to cope with stress by overeating, and oftentimes we resort to sugary and high carb product. And I believe that we are all guilty of baking at home to some degree. And then there comes a problem with sleep when we are feeling anxious that leads to insomnia or maybe sleeping too much. And then lastly, we may have difficulty with concentrating, and that's when we know that we are stressed. Well, there are a lot of tips out there, but for the sake of time, I want to highlight 5 key points in this discussions. Number 1 would be to keep connected, whether through virtually or keeping a good social distance when you are seeing people. This would be important to call up a friend or family. If you are able to check in with them, at least 1 or 2 individuals per day. Most importantly, the people that you share the space with. Sometimes we mistake that we are at home 24/7, but that does not mean that we are talking to them. Number 2 would be time management. Now that we have a lot of time on our hand and then we move our work into our home, the line could be easily blurred. So think about, do you have the time to exercise? Do you have the time for your family? And then do you have the time for yourself? And perhaps that you want to switch to different activities over the weekend. That change in pace makes our brain be more alert and attentive. And then we will see that our weekend is going to be longer when we have these types of break. This is also helpful for us to create a sense of something to look forward to. Number 3 would be nutrition. Are you eating healthy? Or are you going to let yourself loose? Just because you're wearing pajamas all day long does not mean that you can just eat anything that you want. So remember to have a balanced, nutritious meal if possible. Number 4, if you're working from home, you may be in front of the computer all day long, whether it's Zoom meetings, Microsoft Teams meetings, and whatnot, and having to do all of your work on the computer. Remember to take a break. And very important that if you could have lunch somewhere not near your computer or by a screen. So when the weather is nice, go out to the patio or maybe in your kitchen and have a nice lunch, having a nice meal, and just avoid screen totally, just to give your brain a nice break. And then number 5 would be to make the best out of the situation. Although you don't have a whole lot of things to do at home, but to be creative and figure out things that you want to do. Maybe it's a project that you've been delaying for a long time. This would be a good time to do it. I do want to highlight a couple of key points as far as for anxiety and depression so that we could look out for. For symptoms of anxiety, having a persistent worry or feeling overwhelmed by emotions, having an excessive worry about a number of things. Most importantly in this time would be our health problems and finances. And having a general sense that something bad is going to happen. Feeling restlessness and irritability, shortness of breath, muscle tensions, and a tingling sensation in our hands and feet. Concentration and memory is also an issue. And remember what I talked about earlier regarding the stress hormone. All of this is the fight, flight, or freeze response, that it's a natural reaction for our body, but having too much exposure of this could lead to a sense of discomfort. As for depression, the DSM-5 or the mental health provider would look for signs of feeling overall sad and depressed over a period of all day, every day, more days than not over a 2 weeks period. Having a lack of interest and pleasure in activities, having a significant weight loss or weight gain in a short period of time, a lack of energy and inability to concentrate is also problematic. For other individuals, they may feel worthless, hopeless, and overly sense of guilt. And all of these problems, when goes untreated, could also lead to the feeling of better off dead or suicide. And I do want to highlight the suicide piece because that it is the top 5 leading cause of death among individuals between the age of 10 and 54, according to the CDC. And also I want to add another one. It's for the working adults. There are 2 signs or 2 leading causes or problems that leading to someone may consider suicide. That would be a socially disconnected, as well as having financial hardships. Having one or two symptoms of anxiety or depression does not mean that you have a mental disorder. It is a warning sign, just like the check engine lights in a car. It suggests that something's not right here. And it becomes a problem when it causes clinically significant and impairment to our social, occupational, and other important areas of our functioning. Well, first of all, we need to make it okay to talk about mental health. Mental health has been a stigma for many individuals where people have expressed a sense of discomfort when someone starts to talk about their own depression or anxiety. It's also important to be attentive, but also to empathize with others, knowing what they need versus pressuring them to do certain things. And also important is that not every problem could be solved overnight. Perhaps that this individual may need some time to process over, or maybe for you to provide a listening ear to help them through this. But most importantly, that when it becomes a impairment, just as I mentioned earlier, that encourage them to seek professional help. Call up the healthcare provider, getting some help right away. There are a lot of resources that's available for employees and the public at ramseycounty.us/coronavirus, and also on the CDC's website. Other resources are available to the employee, such as the Employee Assistance Program, or known as EAP. Your calls are confidential. You may also talk to a coworker, supervisor, etc. And your family and friends could also be a resource for you if you would like to talk. Call your healthcare provider. A lot of your providers are meeting virtually nowadays through telehealth. That's also an option for you, where you can meet them in the comfort of your own home. And lastly would be the county crisis hotline that's available to everyone. I also want to give a quick shout out to the Ramsey County Children and Adult Crisis at 402 University, that they have been doing a tremendous job responding to crisis call during this time of the pandemic. So that's all that I have for today, and thank you for your time. I hope this information is helpful, and have a wonderful day.